I'm from here. I grew up in Maryville, Illinois. I went to St. Louis University for undergrad, and then I went down to the Caribbean for medical school, American University of Antigua. And then I did my general surgery residency in Youngstown, Ohio, and ended up back here because I did my vascular surgery fellowship at St. Louis University. My family's here, my husband's family's from here, so it was nice to be able to end up back here in where we're from. When my mom told me and tells me all the time that from the minute I could talk, I always said I was going to be a doctor. And my parents aren't physicians, my uncle is, but they aren't, so they never pushed me towards it or anything like that. I just always knew that that's what I wanted to be, and it never changed. When I was in high school, I was a senior in high school, I actually got to be part of a program called the Illinois Governmental Internship Program, which nobody ever seems to know anything about, but it's a neat program where you get to move to Springfield, Illinois and work in places you'd potentially like to be in. So I was able to work with a cardiothoracic surgeon there, and that's when I knew I wanted to do surgery. So I was 17 years old when I got that opportunity. Well, we did a lot of vascular surgery in my residency, so you knew if you really liked it or really didn't like it. Vascular surgery gives you a lot of options for endovascular as well as open procedures, sometimes kind of a hybrid of both. Get to work on arteries, veins, and also get to operate on several different areas of the body, from the neck to the abdomen to the legs, arms. So we're kind of all over the place, which is really nice. A lot of different variety and options to be able to do. Veins is kind of a smaller portion of what we do actually. We deal with a lot of peripheral arterial disease, so patients that have blockages in their legs and have trouble walking or trouble healing wounds on their feet. We can open up arteries or build bypasses in their legs to help get better blood flow down to their feet. We deal a lot with aneurysms, abdominal aortic aneurysms or thoracic aneurysms, and we can fix those endovascularly with stents now, or even some of them the old-fashioned way where you do an open surgery to fix them. Carotid disease as well, patients that have had strokes and have blockages in the carotid arteries. We have several different options for revascularization for that we do. And dialysis access, so patients that need to be on dialysis, we create fistulas, put in grafts, and then maintain them as well. Taking care of patients and their families. When we always say, when a vascular patient becomes your patient, they're your patient forever. They'll come back and see you constantly, and I really enjoy taking care of them. And you go from having a patient that's having severe pain in their leg that's waking them from sleep at night, and you're able to do a procedure and they're so much happier and more comfortable, and they're able to walk around again when they weren't before. Or you're able to fix somebody's aneurysm that they knew they had and were very worried about, and it's just very gratifying to be able to help people like that.